Hi there, my name's Venessa Smith. I've got 20 years experience working in the fertility industry, both in the NHS and privately. I've got experience in the laboratory, but also about compliance and regulation. The London Women's Clinic prides itself on being a very inclusive clinic. We treat couples of all types and also single women. We hope that we create a completely inclusive atmosphere that makes everyone feel comfortable when they're having treatment. Unfortunately, as we get older, our eggs age with us. Therefore, people having treatment over the age of 40s do have slightly different needs. The London Women's Clinic looks at your age, but also the age of your ovaries and how well your ovaries are responding. Unfortunately, we're not able to assess the quality of your eggs, but we are able to tell if you have got eggs still left in your ovaries that we can use for treatment. There are a number of different options. There's genetic testing, which involves embryos being screened for a normal chromosome count, but for some women, they may need to embark on the use of donor eggs. At your consultation, and with the help of your scan and also your blood AMH test, the doctor will be able to offer you the best advice about which treatment will offer you the highest chance of pregnancy. As we age and our eggs age, the chance of having a miscarriage also increases. The majority of miscarriages are due to genetic problems within the embryo. Therefore, one programme that we do offer is pre-implantation genetic screening, or PGS. What actually happens is you'll have a routine IVF treatment, but you wouldn't have a fresh transfer. 5 days after your egg collection, any embryos that reach the blastocyst stage will be biopsied. A couple of cells will be removed and these will be sent to the lab for analysis. The embryos will then be frozen to await the results. When the cells are sent to the laboratory for analysis, what we're looking for is a balanced chromosome complement. What this means is that we'll be removing the chance of the most common genetic problems such as Down syndrome. You will then be contacted by the doctor who will arrange a meeting with you to discuss the results. What we would hope is that you'd have at least one embryo for transfer at a later date. If you do have a normal embryo for transfer, you will then come through for treatment under frozen embryo replacement cycle. This may or may not involve medication, but what we want to make sure is that this perfect embryo is replaced to you when your endometrial lining is in a good state for implantation. The London Women's Clinic is closely linked to the London Egg Bank. The London Egg Bank has an online catalogue of available donors. These donors may provide frozen eggs or fresh eggs. If you're a patient that needs to use donor eggs, you should approach your consultant to discuss this. Once the treatment plan has been put in place, you can then look at the catalogue and choose the donor that is most suitable for you. We would hope that you wouldn't need to wait to find a donor that you feel is perfect. If you're a single woman, you may at that point also want to select your donor sperm, so that we can coordinate the treatments to ensure that the sperm and the egg donor are available at the same time. On the day of egg collection or the day of egg thawing, the sperm will be mixed with the donor's eggs and embryos will be created. When the embryologist calls you the day after egg collection or egg thawing, you'll be informed as to how many embryos are available for transfer. This transfer would generally happen 5 days later. At that point, we would hope that you'd have a good number of blastocysts to select from. The best embryo will be replaced and any that remain will be frozen for a later treatment, hopefully for a sibling. Egg donors that join the London Egg Bank do not have any parental rights over your child. Those rights are strictly limited to yourself and, if you have one, your partner. When you come through for treatment, you will be expected to fill out a lot of consent forms which will be checked by either the nurse or the doctor or the admin team to ensure that there's no concerns after the birth of your child. I hope you found this information useful. If you do want to get more detailed advice, please do contact the London Women's Clinic. You can contact us via email or through our website or by giving us a call. The educational seminars are every 2 weeks, either on weekends or in the evening. These can be really, really helpful when you want to plan your treatment. Good luck.